We think of often jaundice as a disease, but when it is a symptom or a sign, there are many diseases causing jaundice. Let us see about jaundice in today's video. Hi friends, I am Dr. Karamat. This is Scientific Doctor channel. In this channel, every week a health related explanation is given via video. If you want to see such videos, subscribe to this channel. Also, press the bell icon adjacent to it to get instant notifications whenever new videos are released. This week's video is about jaundice. So, why does jaundice happen? We need to understand about the metabolism of bilirubin, the jaundice producing pigment. This bilirubin is produced when old RBCs are recycled. There are red blood cells. These are constantly need to be recycled because the life cycle of an RBC is around 90 to 120 days. As the RBCs become old, they need to be recycled. The RBCs contain hemoglobin. As they are being recycled, this hemoglobin is converted to via metabolic pathways into bilirubin. This is that pigment bilirubin. This is taken to liver for excretion. This is excreted along with the bile into the alimentary tract or into the gut. Then it is eliminated into the stools. Some amount of it is also eliminated via the kidneys. So this is the normal metabolism of bilirubin. So whenever this normal metabolism is disturbed, it results in jaundice. So jaundice is elevated bilirubin in blood. So if you think of it clearly, this can happen because of three reasons. One, you can have more RBCs being destroyed, more RBCs recycled, more bilirubin is produced, so the normal amount is excreted, you have excess bilirubin. This is called a hemolytic jaundice. You may have problems in the liver. Liver is not doing its job properly. Okay, liver has an infection. So because of that, this metabolism is disturbed. This is called hepatocellular or hepatic jaundice. The third type is when you have a block of bile flow, because bilirubin is excreted along with bile. So if this is blocked, you can have a, due to blockage, the liver is normal, RBCs are normal, but the excretory tract where it is excreted is blocked. This can result in cholestatic jaundice. So there are three types of jaundice. We understood there are three types of jaundice, but what are the causes of jaundice? The causes of jaundice can be numerous. This video will not be enough, but if we understand, this hemolytic type of jaundice will happen in problems of blood where more RBCs are being destroyed. This hepatic type of jaundice especially can happen in infections of the liver, hepatitis. So this can be due to viral infections, bacterial infections, protozoal infections. Viral infections can be hepatitis A, B, C, D, hepatitis E. So all these viruses, even other viruses, can cause hepatitis. Commonly, infections form the more number of hepatitis cases and jaundice cases what we routinely encounter. A second common cause, especially in adult population, is alcohol related liver disease. So a person who consumes alcohol for a longer time may have his liver damaged. This might lead to a jaundice happening. You can have gallstones blocking the passage of this bile, resulting in jaundice. You can have other toxic metabolites, toxins from herbs. All this can lead to jaundice. There are other causes of jaundice which I am not going into deep, but when we think jaundice, it can be due to any number of causes. Even cancers of the liver, cancers of the hepatobiliary tract can result in jaundice. So jaundice by itself is not a disease. It is just a symptom where you see that yellowish pigmentation. That's it. And elevated bilirubin again is just a parameter. It just shows that there is some problem. It doesn't identify the cause. So whenever some person presents with jaundice, what are the symptoms associated with it? The symptoms will be based on what is causing jaundice. You might have fever, nausea, vomiting, abdominal distension, abdominal pain. But if there are serious problems associated with it, or there are complications to it, you might have other danger signs like severe abdominal pain, or just even to touch they just wince and cry. You may have changes to their normal mentation. Suddenly they may be confused, agitated, or even comatose. You may have blood in stools or black stools. You may have blood in vomiting. You may have skin patches because of spontaneous bleeding inside the skin. All these are danger signs related to jaundice. Any jaundice, you need to visit the doctor to ascertain the reason for it. Any jaundice cannot be taken lightly, but especially if these danger signs are present, rush to the doctor immediately. So what does the doctor do? The doctor will do tests, obviously blood tests, imaging, that is scans, and other tests depending upon the etiology or the cause of jaundice. The treatment will also depend upon the cause as well as to relieve symptoms. But what we usually understand, because the majority cases of jaundice happening especially in developing country like us is due to infections, we think this is a self-limiting problem. No, don't underestimate jaundice. Rush to your doctor to understand the cause. If it is due to an infection, again, you might be having a simple infection, a self-limiting disease like an hepatitis A virus, or a serious disease like an hepatitis B virus. Even in hepatitis A virus infection, a small proportion may land up in severe problems, even leading to a liver failure. So jaundice is a symptom not to be ignored in any case. So then what is this reason about jaundice being taken lightly, especially in countries like India? Because hepatitis A virus in majority of cases is a self-limiting infection. Within 4 to 6 weeks you tend to get better. People think that it is okay to have jaundice, it is okay to just continue native treatment or herbal treatment without a consultation with doctor. This is dangerous. You need to first ascertain the cause. So after ascertaining the cause, if it is a self-limiting disease, do you need to take these herbal remedies? Herbal remedies, some of them are known to improve jaundice. Yes, if it is due to a cause due to infectious nature, not due to a cancer related or a gallstone related or a hemolytic type of jaundice. It can only relieve if it is due to infection, specifically hepatitis A, sometimes for chronic hepatitis B. For hepatitis B, you need to take other measures. Along with that, some herbal remedies may help. So, taking herbal remedies alone, especially without consultation by a qualified medical practitioner, can be detrimental, can even lead to death. So, don't take jaundice lightly. What about other symptoms associated with jaundice? Because usually jaundice is treated based on its cause. Once you treat the cause, these symptoms will also come down, but you have effective measures to treat the itching associated with jaundice, all other problems. So whenever you identify or suspect jaundice, kindly visit your doctor to ascertain the cause. Friends, this was a short video about jaundice. If you like this video, share it among your friends and relatives. If you have any doubts, kindly post it in the comment section. If it is possible, I will answer them via simple answers. If it requires a detailed explanation, I will post them in subsequent videos. If you want to see such videos, subscribe to this channel. Till we meet again, bye.